Okay, this is the third in the series of the immune system, cytokines, about cytokines, the killers of all pathogens. Oh, I'm going to talk about the neutrophils carrying these cytokines, and also basophils, antibodies, anaphylaxis. And then we're going to talk about how the nutritional state affects your immune response. So just to review, the red circle is a depiction of your vascular system carrying these white blood cells, basophils, neutrophils, eosinophils, macrophages. And they are considered the first responders that are responding to what they believe is an invasion. And the other circle is the lymphatic circle. So the lymph nodes are carrying B cells, T cells, and when they get activated by a dendritic cell, they can create these activated lymphocytes, killer Ts, and activated B cells, and they also can become first responders. So remember, dendritic cells are the ones that identify the pathogen, take the information, and initiate these B and T cells into becoming activated. A patient comes to your clinic complaining of excess fatigue. Routine blood work shows a very high white blood cell count. What is one possible reason for a very high white blood cell count? And the medical term for a high white blood cell count is leukocytosis. Cytosis means a large number of cells, and leuko means white, so a high number of white cells. Now, surprisingly, the answer is bacterial infection. For some reason, viral illnesses have more of a tendency to depress bone marrow than bacterial infections. So causes of high white count, which is greater than 10,000, you can see that in bacterial infection, stress, prednisone can do that, and leukemia can do that. Also, people that are pregnant can also have a little higher white count than normal. Leukopenia means a low white blood cell count, usually below 5,000. And those are things like viral infections, tuberculosis can cause that, HIV infection, erythrocytosis, or another word for that is too many red blood cells. And they're just taking the space of white blood cells in the bone marrow. So it drops the cells of white blood cells. So this is a depiction, not a depiction, but the actual real thing of a thigh abscess that's being drained. This is a little boy that fell from a tree and this abscess got infected. So the drainage of a thigh abscess, what is in this pus? Now this is bloody, but that is also showing what pus looks like, that fluid and milky fluid. Is it the tissue or the contents of white blood cells? And the answer is both. It's both dead tissue and the contents of the white blood cells, specifically the first responders. So when you're battling against infection, these first responders are there first, and they do it indiscriminately, which means they release these chemicals called cytokines. And the cytokines that they release kill everything. They kill not only pathogens, but they also kill host tissue. The one that's most prevalent in the blood are these neutrophils. This is showing a neutrophil, and this is after staining of a neutrophil. So all of these little blue balls inside this neutrophil are these cytokines. And this is the neutrophil. This is the actual nucleus. So it's multilobular nucleus. Multilobular, I should say. Okay, so let's look at a common lifestyle that reduces neutrophil mobility and function. And this is a video showing a microscopic video of a neutrophil doing its thing, eating up pathogens. So the answer is sleep deprivation reduces neutrophil mobility and function. So an impaired immune function lowers the ability of these white blood cells to, attack bacteria. And phagocytosis is the term is eating. Phago means eat, eating cells. All right, let's go through a scenario. Your roommate catches a cold. It's going to be a virus. 5 days later, you start getting sick with upper respiratory symptoms. So I'm going to go through the stages of what happens. So stage 1, you've got this virus invading. And the first stage is this real runny nose. Rhinorrhea means runny nose, like a rhinoceros. Rhino means nose. Sneezing, coughing. All of that is initiated by these really smart viruses that tickle your nose and encourage you to sneeze and cough, blow your nose, and that is its way of spreading onto others to become covering everybody to increase its mode of transmission. So what cells are releasing cytokines to kill off this pathogen? Is it your first responders, neutrophils, killer T cells, or B lymphocytes? Your answer should be it's your first responders. Quick recall there. The second stage is that congestion. This is when the mucous membranes are swelling. Remember how the swelling with any kind of infection or invasion. So now the first responders are releasing the cytokines, or the neutrophils, and specifically the neutrophils are releasing cytokines, and the cytokines cause this inflammatory response and swelling. So in the meantime, what cell has eaten the antigen, in this case the virus, and then gone to the lymph node? The first responder, dendritic cells, or B lymphocytes. Hope you remember it's the dendritic cell that's taken the information to the lymph nodes. Okay, so the next stage, recovery. This is the stage where everything is coming out green and yellow. I'm always happy to see that for myself because I know I'm getting into recovery mode. So the contents, this green and yellow snot that's coming out is actually from neutrophils, macrophages, and dead host tissue. And that green is actually myeloperoxidase chemical inside neutrophils. So what cells prevent relapse, meaning that you will never get this exact virus again? The answer is your activated B and T lymphocytes. All right, so let's go on to the other cell. We've gone through neutrophils. Basophils are the ones specifically that are responsible for an allergic reaction. They produce histamines. They cause intense vasodilation of blood vessels. And because of that, they cause intense swelling. This is a true story. This is actually my nephew, Josh, was a beekeeper, and he'd get stung occasionally, but never had really any problems. One day after 10 years, he gets stung several times and he collapses on the ground trying to make it back to the house. And what he's experiencing is anaphylaxis. Anaphylaxis is an over-dilation of these capillaries with massive extrusion of capillary contents. And because it's this massive vasodilation, the blood pressure falls, so you get hypotension. All tissues swelling. The thing that's most concerning about anaphylaxis is when it swells to the point where the airway is obstructed. It can also cause these intense bronchospasm, which is the muscles, the smooth muscles around the bronchioles and bronchi tighten down, and they also prevent airflow. So this is a sagittal view looking at the upper airway. Notice that behind the tongue, that area has little room for expansion. So anaphylaxis, blood vessel swelling, edema, all of that can close down the back of the throat. And also the tongue can swell, all of that can swell. So anytime someone complains of tongue swelling or that they feel like their mouth is closed, throat's closing off, that's the time to get to emergency medical care. So let's go through the pathophysiology of what's going on with this bee sting. You have your initial exposures, things are going along pretty well, and eventually the B cell starts to identify that there is some foreign material and starts to generate antibodies. And those antibodies end up attaching themselves to the cell's basophils. So anaphylaxis is when everything goes exaggerated. And then when another episode of finally another exposure or a massive exposure, all those basophils release all their granules, those cytokines, and then it creates massive swelling, redness. So anaphylaxis is an exaggerated allergic reaction. So concern for anaphylaxis is, first of all, making sure the airway's open and they're breathing, your ABCs basically. The treatment, of course, while you're calling 911 or for help, is to make sure that person can get oxygen, epinephrine, antihistamines, steroids. Steroids slow down that immune response. And of course, intravenous fluids, because the blood pressure is so low. The mechanism of action of epinephrine is it's a very potent vasoconstrictor. So it constricts the blood vessels, raises the blood pressure, and stops swelling. Specifically, this is a subcutaneous dose, so you need to really know what you're doing. I mean, you could give it intramuscular. Point is just get it into the system, but not into the intravascular system. I had that one time with a fellow intern that inadvertently put it in the IV of a patient in anaphylaxis, and the patient had a heart attack. All right, let's talk about nutrition and the immune response. The immune system likes to perform best at a perfect weight. So malnutrition, it doesn't work as well. Overnutrition, it doesn't work as well. So there's a perfect sweet spot. And it looks like a J-shaped curve. This is another situation that's a J-shaped curve. So mortality rate and body mass index. So looking down at your all-cause mortality, patients that are malnourished, don't fight off infection well, people that are overnourished also have a higher rate of mortality because they do start to develop inflammatory diseases, heart disease, hypertension, diabetes, and also they create these autoimmune disorders or a overreaction of autoimmune disorders. So an example of this happening is this most recent problem with COVID-19 infections. Patients that had BMIs greater than 30 are more likely to develop this acute respiratory distress syndrome. And this is where they need ventilator support and the treatment of this response. Actually, their immune system is over-responding by these neutrophils, and the neutrophils are releasing cytokines. So with ARDS, acute respiratory distress syndrome, the cytokines are released, and they develop what is called a cytokine storm, where the immune system is overreacting. And all these cytokines are being released, and all that cytokine is trying to kill off the pathogen, but it's because it's acting like a bomb, it's killing off host tissue along with the pathogen. So this is cytokine storm, respiratory failure. This was an image from the Italian ICU trying to improve oxygenation by having patients ventilated in the prone position. Malnutrition has too little of immune response. And an example in a low resource setting where I was is this little boy, as a 12-year-old, had a little cut on his leg. He is actually an orphan. He's very malnourished, and he quickly developed an infection of his bone, and that's his tibia that's protruding out of his shin. So he was admitted for nutrition, and then after nutrition, antibiotics, he came to the operating room for surgery. And unfortunately, this had to be amputated. His leg had to be amputated. So this is at age 12, age 14, 2 years later after his amputation, and now at age 16, doing very well. So the next is the autoimmune. Autoimmune is where the body gets confused and starts to attack itself. So I think it's depicted well in this cartoon where the cells are saying intruder, destroy. But I'm one of you, don't listen to her lies. So the case presentation is a little 8-year-old girl. Her fever is over 102 degrees. She's got a severe sore throat and she's unable to swallow. So she didn't have any treatment for her sore throat, but then she started developing joint pain. So she was taking the doctor for this joint pain. And there she was diagnosed with rheumatic fever. She was given antibiotics, and there was concern that this rheumatic fever was going to develop rheumatic heart disease. So her physical activity was restricted for actually many years. So rheumatic fever is this inflammatory disease that can go to the brain, to the skin, to the joints, and also to the heart. So the heart can be a very latent diagnosis. So this is the little girl grown up 40 years later. And she's starting to have shortness of breath, rapid heart rate. She has a treadmill test, and the heart rate jumps up after 2 minutes only. And now she has mitral valve disease as a diagnosis. So these are the complications of untreated bacterial strep throat. The acute can be ear infections, sinusitis, abscesses, rheumatic fever, toxic shock. Those are all the complications of untreated infection. And then the chronic complications are the development of autoimmune diseases. So patients can lose their kidneys years and years later from having an untreated strep infection. They can also develop heart disease because the body's antibodies attack the cells on the aortic and mitral valves in particular. Another autoimmune disorder that's actually pretty common is Hashimoto's thyroiditis. So the antibodies that the body's developing against this virus look very similar to thyroid cells. So after the body creates all these antibodies, it starts attacking its own thyroid. So patients will present like almost like a thyroid storm, and they'll get hyperthyroidism, and eventually the thyroid will burn itself out, and the patients will eventually need to be on thyroid replacements. So in summary, the immune system, neutrophils, and are the bombs. The cytokines are the fuel. We talked about anaphylaxis being an overabundance of or a massive release of activated mast cells or basophils, and how the immune system loves a perfect weight for the optimal immune function. Malnutrition is too little, overnutrition is too much. And then autoimmunity, where cells create antibodies that attack their own cells. So cytokines are very useful. They destroy the pathogen, but they're slow in malnutrition, and with sleep deprivation, they slow down neutrophil migration. And then there's an overreaction with BMIs that are over 30. It's a perfect sweet spot. Again, showing how when the autoimmune disorder is when the body confuses itself from an intruder. Examples of autoimmune disorder: rheumatic heart disease is one example where it's an untreated strep throat. Myocarditis from COVID-19 infection. Hashimoto's thyroiditis. And another autoimmune disorder is rheumatoid arthritis, which is a different pathophysiology than rheumatic fever. Okay, any questions, comments? Please subscribe to the channel. Thank you.